Good morning, lecturers and nurses. My name is Kingsley Otugo, and my student number is 006 110 4311. I am here to give a presentation on Nursing 1102, that is Literacies and Communication for Healthcare. And this presentation shall cover the following key points. Firstly, I shall be talking about the analysis of verbal and nonverbal communication in the given case study. Secondly, I shall discuss the documentation of the ineffective communication using the SOAP tool. Thirdly, I will discuss the clinical handover using the S-bar tool. Fourthly and finally, I shall conclude with how written and verbal professional communication contributes to the patient safety and equality in nursing practice. Okay, so we shall be looking at the analysis of the verbal and non-verbal communication between the three parties involved, that is the nurse, the patient, and the patient's family. Now, before this, what is verbal and non-verbal communication? Now, verbal communication involves the use of words, that is, speaking words, and while the non-verbal or the verbal communication actually structured and vary among culture, age, socio-economic group, background, age, education, and so on. Now, the non-verbal communication, this is not reliant on words. It is expressed facially by gesture, posture, physical barriers such as distancing, and so on. Hence, it is termed as a body language. Now, there are two acronyms that are used to analyze the non-verbal communication skills in this case study, and these are the empathy, which describes the significance of non-verbal communication empathically, and SOLAR is another acronym, which is a model for active listening. Now, let's look at the analysis of the communication between the nurse, the patient, and the family. The patient stated that the nurse told him that he will be going home over the weekend. This is ineffective communication, because intended meaning was misunderstood by the patient. Now, we shall be looking at the patient's side. The patient appears to understand English, of course, because he communicated properly with English. And however, the confusion is understandable on the patient's side. This is because he's very advanced in age, with self-care and mobility challenges. He grieves over his wife's death and is upset about leaving his home. Hence, there is a high possibility that he'll be confused and he'll misunderstand, certain communication. Therefore, the nurse, although on the nurse's part, she has done a very good job in praising Mr. Rossi for the self-care. However, the nurse did not utilize the right communication approach and strategy, which led to the ineffective communication, of course, and hence the misunderstanding in the case study between the nurse and the patient's family, of course. It's ideal to understand that while communicating by the nurse, though, the nurse should have understood while communicating with the patient, that is Mr. Rossi, there is need to understand that he's an aged man who, despite all his current condition, which are the mobility issues and the self-care issues, is recently bereaved, and upset about leaving his home, and he's most likely to be faced with confusion. Hence, it is really important to allocate adequate time when communicating with him, or we'll try to pass an important information to him. Therefore, while the nurse was communicating with him that morning, it is ideal to choose words wisely. Consider the pace and intonation of the word. The pace should be slow, so an intonation very clear, so he'll understand perfectly. The message should have been very simple, and brevity should have also been considered. And all this should have been done in line with the 5 out of the 7 C's. Now, the 5 C's out of the 7 C's of communication, I'm talking about clarity. Message should have been clear, consciousness, you conciseness, sorry, and concrete, and coherency. It should have been coherent, and completeness should also have been considered. And this way, the patient knows exactly what is happening and be able to, differentiate and tell that, oh, this is exactly what I'm being told by the nurse, that praising me, and and that, basically he was confused. Everything he wants to hear from anybody right now at that point is that he'll be going home, and that's the reason why he basically, you know concluded that the nurse had told him he'll be going home. So, the message should have been coherent, but most importantly, clarity should have been clear, so he would understand it. He will hear you, what we hear, would have heard what the nurse was saying, you know, and simplicity, intonation, and pace too is very important, like I mentioned before. So the nurse's pace should have been slow, and intonation very clear, so the patient understands what the nurse was saying. Yeah. So telling a patient that that is expecting or telling a patient a story, or telling him something that he concluded on, or assuming, yeah, he just concluded that he will be going home, and the next minute you're telling him um, that, oh, it was a misunderstanding. This will trigger him. He will be, it will impact on the patient, and it could be very severe, because he be disappointed, and self-harm will be his thought. Self-harm, will be the thought, and anger, and yeah. So basically, the nurse should have been very clear with his or her words, you know precise, and the intonation should have been very clear too, and pace very slow. And this way, Mr. Rossi would have understood clearly what the what he was being told, and he would have understood that he was being praised for his self-care, and not the other way around, that he'll be going home. Okay, so this is the continuation of the analysis of the communication between the nurse, the patient, and the patient's family members. Now, we can see that there's a place where the family was asking asking the nurse about why their dad was told he will be going back home soon. This is actually ineffective, because it led to the interruption from Mr. Rossi, and the conflict between the nurse and the family member, that is Mr. Rossi's son. So, having said this, it is very important to even understand that the family members play a very significant role in patient's recovery, and with regards to what happened, there is no way that particular communication is effective or therapeutic. It's not effective in any way. As the patient Mr. Rossi actually has more trust for the family members than the nurse, which is ideal. There was basically no way the nurse could have pulled that off, or been able to convince both the patient and the family members at the same time. Hence, the strategy and approach used in that particular situation was ineffective. The nurse should have done a good job by separating Mr. Ross's family member, and clarify the misunderstanding with them before even approaching Mr. Rossi. This would have gone a long way to ease the atmosphere and give the nurse even a better room to correct Mr. Rossi's misunderstanding. And Yeah, even the family members would have helped her, helped the nurse in getting their father in the right track as well. Hence, therapeutic communication could have been much easier and effective between the nurse, the patient, and the family members. However, the nurse tried to, correct this misunderstanding as quickly as possible, but was interrupted by Mr. Rossi. This made the communication ineffective still, although the nurse did good by, keeping quiet when Mr. Rossi was explaining, because silence is an effective non-verbal communication technique in the given situation. If the nurse had engaged Mr. Rossi in the communication, it would have led to even worse escalation. Now, the other one is when the other communication that was analyzed was, the conflict where there was a conflict between Mr. Rossi's son and the nurse, would have when the nurse tried to clarify Mr. Rossi. First of all, the nurse was passing the right message across to Mr. Rossi, but the skill and approach was ineffective. The nurse leaned over Mr. Rossi and spoke loudly to him, even even when it is clear that Mr. Rossi was not deaf. This approach appears intimidating and bossy and does not in any way represent therapeutic care. It is ideal to note that leaning over a patient is an ineffective nonverbal communication technique, and speaking loudly is not verbally effective either. That was the reason why Mr. Rossi's son got up with, I mean, sorry, well, that was why Mr. Rossi's son got upset with the nurse. Uh, Almost all culture frown at, disrespecting aged ones, not to talk of a family member. Nobody would like to see their parents or their father treated like that. Not even the nurse involved in the case study. For a better effective communication, the nurse should have, applied the empathy, which is an acronym that boosts empathic nurse-patient interaction, and also the SOLA, which is a good active listening model, together with the therapeutic touch and a friendly tone of voice. Now, the empathy has to do with eye contact, muscle of the face or facial expression, and the posture, the affect, and tone of voice, hearing, and the response. So in this case, um, it is only ideal for the nurse to maintain a friendly eye contact, keeping if also a friendly facial expression while talking to Mr. Rossi. And the posture should be, you know, the nurse should keep an open posture and sit beside Mr. Rossi at eye level. This shows attention to patient, and the tone of voice. The tone of voice should be watched, which is the reason why Mr. Rossi's son acted in the first place, because the nurse's tone of voice was very loud. This was not accepted by the family members. The nurse should have kept a level tone of voice while conveying the message. On hearing the whole patient, patient-centered care is holistic. Hence, it requires listening to the patient wholeheartedly. This is active listening, where the solar comes in play. We'll be discussing the solar shortly. And the response, even with the shocking and distressing event, I think the nurse actually handled the situation handled the situation professionally. Now, talking about the solar, which has to do with active listening, there's the S stands for square, O for open, L for lean, E for eye contact, which we've talked about before, and R for relax. So basically, it is ideal to keep to face the patient squarely and to to show the patient that you're paying attention entirely to him or her. Open is also to maintain an open posture, as mentioned before, not crossing the arms and legs. and we are leaning forward towards the patient. You don't have to stand over the patient to lean forward. You can sit with open arms and open posture to and lean towards the patient. This way the patient will feel cared for and will feel cared for. Now, the eye contact involves maintaining eye contact, as mentioned before, so the patient will not feel, insignificant, or maintaining an eye contact to signify that you are not distracted from the patient. This way, the patient will feel cared for as well. Feel relaxed. There's no need to fidget you know or feel confused. It's better to stay calm and stay focused even in the current situation. Now, techniques and approach include the therapeutic touch to reinforce emotional support and personal attention and tenderness. After the conflict, after the conflict with Mr. Rossi's son, the nurse said, "Sorry, Mr. Rossi, but you need to tell your family the truth." This is another ineffective communication right here, where the nurse said, "But you need to tell your family the truth." This is not therapeutic, hence is not effective. And by saying that, it implies that Mr. Rossi is telling a lie, and to the family members, it means that their dad is telling a lie, which is not good at all. It is a good thing for the nurse to have left the bedside after that, because it would have caused even more conflict. I think the ideal thing to have said is basically apologize for the misunderstanding and leave the bed space without asking the Mr. Rossi to tell the family the truth. That would have been therapeutic. And the final one is speaking to the colleagues. This is therapeutic to me, because it will help in setting the nurse back in the right track. Also, it will help in the breathing process, hence an improved self-reflection and self-care on the nurse's part. So next we'll be looking at the grief and loss. Now I shall talk about the grief and loss. From the case study, Mr. Rossi actually has every right to express grief over the loss of his late wife, because as we all know, his wife used to be his carer when she was alive. And even being away from his family home, also happens to be a significant environmental change in Mr. Rossi's life. And I can admit that this is a tough transition happening in Rossi's life at the moment, and even at his advanced age. Hence the nurse needs to find out things or activities that could distract Mr. Rossi most of the times from grieving too much, and nurse may actually also seek assistance from the family. As we all know, the family plays a major role in supporting the patient through grief and loss in many ways, such as identifying what the patient enjoys doing, so the nurse can prompt him into doing these activities most of the times. you know this can be this can be helpful in checking and monitoring Mr. Ross's grief and loss. So basically, finding any outdoor activities that could distract him from grieving is ideal in this case. A monitored grief is monitored grief helps to process pain of loss and allows it to heal. In Mr. Rose's case, it actually monitoring this grief and loss which he faces can help him heal quickly, and by actually prompting him to go and do some outdoor activities could make it also, it could distract him. Then it distracts him at that particular moment, but in the long run, it basically helps him to heal faster and smoother. Hence, the duty of the nurse is caring for this patient and addressing his grief and loss appropriately by providing him with caring conversation, not forgetting to take the patient's culture into consideration, because we know Rossi and family are Italian, so it's ideal and very important to take his culture into consideration. And the ways to do this is by inquiring and seeking and inquiring and asking questions from family members or even the patient himself about the do's and don'ts in their culture. This way, the nurse will will ground him or herself in understanding what their culture means and how to work with their culture in line with their culture. Also, talking about the caring conversations, employing the 7 C's, which is the caring conversation, ensures the delivery of compassionate care to Mr. Rossi by utilizing the key attributes like being courageous. That is, the nurse themselves should actually be courageous in what they do, not showing any sign of fear or anxiety. This way, the patient himself and even the patient's family will know that this person is up to the task. And connecting emotionally is something else that is significant in this case study, because connecting with Mr. Rossi and family emotionally would help them trust the it will actually help them trust the nurse and be open to her. And this way, therapeutic care can be delivered, easily. Being curious is another one. So, being curious is what I was talking about, like asking questions about culture and identifying do's and don'ts of the culture by asking the family members or Mr. Rossi himself about the do's and don'ts of their culture. This is being curious. This will make you understand the patient better to be able to connect to him and even the family. Considering alternative perspectives, these are finding other ways that could help in solving the issue on ground, or yeah, or actually help in healing Mr. Rossi faster and easily. And finding alternative perspective is when one thing doesn't work for him, or one outdoor activity doesn't work for him, you find an alternative, or whatever he wants doesn't work for him, you can also always find an alternative to solve that situation or to solve that issue to be able to move forward. Collaboration is the next thing, because basically this is very, very important, because the three parties involved need to work together in order to achieve the aim. So the family, the patient, and the nurse should work together to be able to achieve the ultimate aim, which is getting Mr. Rossi back into his normal, getting Mr. Rossi to accept the fact that um, his wife is dead, and he's going to be staying in the aged care facility for a long time. And also, um yeah, that's about that. Then compromises has to do with in this case study, the compromise has to do with foregoing or actually forgetting things, as in the case of Mr. Rossi, forgetting about, not totally forgetting about his wife, but cutting that emotional part, most of that emotional part off, so he'll be able to face the future and move on with his life. These are the compromises that need to be made, and this is what the goal is, and this is basically what the nurse and the family members aim to achieve. And celebration is the final part where everybody is happy. Mr. Rossi is back to his normal state of mind, and he's living as a very, very normal person. This is where the celebration comes in, and everybody is happy about what has been achieved. This actually boosts the nurse-patient relationship-centered practice and include the patient and family-centered care. That is, I'm talking about the seven caring conversation. Now, we shall also be looking at the 5 stages of grief. Because understanding the 5 stages of grief would help the nurse, you know, basically and easily assist Mr. Rossi through his grief and loss. And these 5 stages of grief include the denial, the anger, the bargaining, depression, and acceptance. We are actually looking to use the Kubler-Ross 5 stage of grief in this case study, and it can help the nurse also identify the grief phase which the patient is in, and the therapeutic measures that can be applied to this phase. Now we have the denial which happens to be conscious or unconscious refusal to fact, information, and reality is the first. This is the first stage, and Mr. Rossi was not accepting the fact that he was going to stay in the aged care facility and wasn't accepting the fact that his wife was dead. You know, the next one is anger, which can manifest in different ways. Now, basically, interrupting the nurse why he or she tried to explain was driven by anger. That is when Mr. Rossi interrupted the nurse. That was driven by anger because he didn't want to hear any other thing apart from that he will be going home. And bargaining, you know, patients can bargain or seek to negotiate compromises. For example, when the patient the patient was always asking, when can I go home, when can I go home. This is an a, this is bargaining to me. Because he's bargaining with the nurses and the facility about when he can go home. Depression, depression in the case study, Rossi is actually depressed because he misses his wife and he misses being independent. He also misses his family home. Now, the acceptance is the phase which the three parties should be looking at, mostly the nurse and the patient's family. This stage it varies according to the patient's situation. Although the indication is the emotional detachment and objectivity. This stage, this is the stage that the nurse and the family actually aim towards, so that not Rosie will accept the fact that will accept what is happening for the rest of his life. So we shall be looking at the cultural awareness, but before I go into it, what is culture? Culture is the way that a society or a group of people think or behave which is socially acceptable among them. Now, from the case study, Mr. Rossi and his family are Italian, which suggests there's a cultural difference between them and the nurse. Although observations showed that Mr. Rossi had no issue with his communication and also his spoken English was accurate. However, some issues that were identified here include he found it difficult adapting today or to his new environment, and also the tone of voice that was used by the nurse to address him while the nurse tried to correct Mr. Rossi's perception about the praise accorded him in the morning. This was actually unacceptable by Mr. Rossi's son and deemed very rude. I mean, nobody would like to see their parents being yelled at or talked to in such a manner. It is culturally acceptable, however, to speak to elders in a respectful manner. Hence, it would have been best if the nurse utilized most of the communication tips that can be used to communicate with individuals from different or multicultural background. And these tips include developing a trusting relationship, be honest and admit to mistakes, paying attention to body languages such as cues, being explicit, clear, and slow in speaking. This is the point I want to talk about because this was not properly utilized by the nurse in the morning. If the nurse had spoken clearly, be explicit and slow, that morning, I mean, Mr. Rossi would have understood every or the message that was passed across to him, and there will be no misunderstanding. The next is to avoid metaphors and jargon. I'll tie this also to being explicit, clear, and slow because the nurse might have used some medical jargons or metaphors which Mr. Rossi did not understand in the morning to pass across the message, and this might have caused confusion and led to the misunderstanding as well. Sorry, there's also invite and exchange cross-cultural information by asking people to tell you about their culture and country as well and so on. Now the nurse can actually inquire from Mr. Rossi and family about their cultural background in order to work in line with that to deliver a therapeutic care and build a therapeutic relationship with Mr. Rossi and his family. There's also being patient, which is a very good one. Identify ethnicity, country of origin, and spoken language. I'll tie this to the to uh, asking for cultural information or cultural background, questions about cultural background as well, because they go hand in hand. Now there is also the use of ask, tell, ask, which involve asking the patient a question, then explain clearly to the patient, and ask the patient if he or she has understood the message. The nurse should have utilized this in the morning also to be sure that Mr. Rossi understood the message that was passed across to him. Else, the nurse should have explained even better. Therefore, there are certain attributes that can also be used or be utilized. There are certain attributes that should have been utilized by the nurse rather, and this involves the awareness, which includes two things. That is, the nurse should have actually understood that Rosie and his family were from a different cultural background, and also be self-aware of his or her own culture in order to tie this together to be able to move forward and deliver a therapeutic care, as well as build a therapeutic relationship between Mr. Rossi and between the nurse, Mr. Rossi, and Mr. Rossi's family. Also, attitude, being curious and willingness to learn is one attribute that is highly recommended in nurses, because the patient and the patient's family would like to say this in nurses. Humility is another one, and never take things personal. It's just advisable to bounce back. The the nurse in this case has taken left the bedside at the end of the case study and went to speak to his or her colleagues regarding what had happened. This is a very good way of bouncing back and being bouncing back and having personal care for his or herself as a nurse. Now we have the knowledge. Knowledge goes into the various aspects, like knowing the hospital's policies and protocol, as well as resources, as this will help the nurse to engage with the patient properly. Also, knowing the patient and their history, identifying or knowing the history of Mr. Rossi would have helped the nurse communicate with Mr. Rossi better, as well as even communicating with the family members. We also have understanding the non-verbal cues. Yeah, as we all know, cues may differ across culture. Therefore, it's advisable for the nurse to understand what cues mean in Mr. Rose's culture and be able to utilize them properly. We also have knowing the political and social environment from which the patient comes from. Knowing this will help the nurse to identify, or to to identify the reason why, or find ways of connecting Mr. Rossi to his new environment, which is the aged care facility, because ha- creating a very a very creating a familiar political and social environment for Mr. Rossi in his new environment as the aged care facility would help him actually connect well with the environment. Therefore, with these attributes and tips, it is it will be very good for the nurse, and as it will enable as this will enable the nurse to establish a therapeutic relationship between the patient and his family, therefore increasing the chances of the patient-centered care and family-centered care. Next, we shall be looking at the critical reflection. In this slide, we shall be looking at a critical reflection on resilience and self-care in healthcare communications. Reflection practice involves a purposeful self-examination and questioning of an experience or incident, as in the case study, usually under the guidance of a professional healthcare supervisor, and it is very useful. It is a very useful tool in measuring performance and considering alternative actions. Hence, it basically enables um, healthcare workers, such as the nurse in the case study, to facilitate learning and improvement of practices. For the reflection on self-care and resilience, uh, I I I shall utilize the Gibbs reflection cycle, which has 6 stages. And first, we shall be looking at what actually happened in the case study. And the nurse had just attended Mr. Rossi, and there was a misunderstanding between the nurse, Mr. Rossi, and Mr. Rossi's family, because Mr. Rossi had mistaken the nurse's positive praise uh, in the morning was a promise that he will be going home over the weekend, and he had communicated this to his family members. Hence, his family members questioned the nurse as to why their dad had been, you know, told this. When the nurse tried to correct this impression, however, he or she, the nurse, spoke loudly to Mr. Rossi. Mr. Rossi's son stood up and approached the nurse and loudly rebuked the nurse from, talking to his father in such a rude manner. Again, this ties back to the cultural awareness which we talked about. If she was culturally aware, she would know that. This even goes beyond the cultural awareness, because nobody would like to, have their parents or their father yelled at or talked to in a rude manner. However, in the course of approaching the nurse by Mr. Rossi's son, the nurse stepped back from Mr. Rossi's son and asked Mr. Rossi to speak the truth to his family, which is again ineffective in what we analyzed. And the nurse left the bed space. The nurse left the bed space to discuss about the stressful morning with Mr. Rossi to his or her colleague. Now, next, what was the nurse feeling in that particular instance, given that situation? At that point, amidst all the chaos, to me, I felt the nurse was frustrated and upset, and at what was happening at that moment. It was actually, regretful. It was. I know the nurse might feel regretful of praising Mr. Rossi in the first place. You know, there's a feeling of being set up by the patient. That is, the nurse might feel he or she was set up by Mr. Rossi. Next, is like she will feel. The nurse will by the um, feel hated by the feel like the nurse will feel hated and basically scared of being hit by Mr. Rossi's son, as adrenaline actually spiked up. On the other hand, the nurse, the nurse basically understood the patient and the family, because the patient was experiencing grief and loss, and must have been confused about the whole thing that is happening, and and most likely be in a confused state. Hence, the nurse felt pity, compassion, and empathy for him. Mm. As for Mr. Rossi's son, it is still understandable. His actions were, yeah, totally understandable, as nobody will appreciate anyone talking to their dad in a way that seems rude or that appears rude. Now, we'll be looking at what the nurse's evaluation was or will be. The situation was an educative one, because it will help build the nurse in case the nurse is exposed to working under pressure, and maybe exposed to that kind of situation in the future. you know and what had happened, it was an enabler to respond
yeah, it was an enabler to respond better in the future. And it actually, like I said, it actually it actually exposes the nurse to working under pressure. Next is the analysis of the situation by the nurse. Now, what was the analysis done by the nurse regarding the whole situation? What did the nurse analyze the situation to be? You know, what was the nurse's perception about the whole thing? Now, talking about this, there is a need to always ensure balance between the patient-centered care and the family-centered care, by healthcare professionals. Basically, trust is one of the aspects that the nurse, should have developed properly with both the family and the patient. However, the nurse realized realized bad, and basically every nurse realized that there's always a good and a bad day, which occurs in the work environment. And yeah, therefore the need for the person-centered care and family-centered care practice in order to remain in a trustworthy um, and healthy relationship with both patient and family members. So this is by respecting their culture, dignity, and value. This is the only way, or this is a part of, or one aspect of the ways that this trust can be achieved. And what was the nurse's conclusion given the situation? The nurse could have, done better by being very clear and audible while communicating with Mr. Rossi that morning. This would have helped solve the whole situation. There wouldn't be a situation, or there would be no situation if this had been done properly in the morning. That is, the nurse being clear and audible in his or her communication. Also, the nurse could have asked him if he was clear of the praise in the morning, to be sure they were on the same page and there was no misunderstanding. This goes back to the ask, tell, ask, which I explained in one of the slides before. So the nurse should have avoided the use of any form of medical jargons or even ambiguous words while communicating with him in the morning, to avoid any form of confusion still. And when the nurse was trying to correct the impression, the nurse should have sat close to Mr. Rossi, maintained eye level with an open position, and with a smile on his or her face, and use the therapeutic touch to re-explain that he, that is Mr. Rossi, had misunderstood the whole communication that morning. That instead of using the loud voice and standing over him, which is not acceptable and deemed as being rude. And after this, the nurse should have just apologized for the misunderstanding in general and left the bed space. So, lastly, what action plans has been considered or were considered or put in place for this, or for the situation that occurred? And the nurse should ensure clarity is maintained, or yeah, clarity is maintained in the future. And ask, tell, ask is should be used where appropriate. You also seek assistance from the colleagues when necessary, and be culturally aware, which is important too, by discussing culture with patients and the patient's family. Also, nurse should always respect the patient's culture, value, and dignity, and ensure family members are always kept in loop of vital information at all time. So, yes, this is all about the critical reflection. And next, we'll be going to the communication tools. Sure. Now, this slide we shall be looking at the ineffective communication using the SOAP note. Before I delve into this, I shall be looking at what the SOAP note is. Basically, the SOAP note is a patient-oriented tool for the analysis of patient signs and symptoms, which are presented in certain structures and are useful in admissions record, medical histories, and other records in the patient's medical chart. Now, the substructure includes the subjective part, the objective part, the assessment part, and the plan part. Before this, we shall be looking at the patient's current condition. And Mr. Rossi requires supervised care and mobilization. He's also recently a widower who is still grieving over the loss of his wife. His goals are to attain unsupervised living and most likely to go back home. And we're now going into the subjective part of this. Mr. Rossi is basically a 90 years old man who is unsafe for unsupervised self-care and mobilization. He is recently a widower, as mentioned before, and is still grieving over the loss of his wife, and is also agitated about leaving his family home to an aged care facility. Now, the problem that has been faced in this case study is that Mr. Rossi has had mistaken the nurse's praise for his supervised self-care as a promise that he'll be going home. So he also mentioned this to the family, that the nurse had told him that he'll be going home that weekend. And according to him, what he said is, he said that the nurse praised him for his self-care in the morning with no help from the nurse, hence that he is fit to go home over the weekend. And now, in the course of correcting the information, Mr. Rossi's son now said loudly to the nurse, "Don't speak to my father like that. He is not deaf," and that was very rude. That was a very rude way to speak to him. Um, and that is actually the subjective part of it. Now, moving to the objective, we have to check the vital sign and general appearance and incidents too. So Mr. Rossi requires assisted mobility to move around, and he also requires assisted self-care. Basically, the patient is still bereaved over the death of his wife and is upset about leaving his home, as mentioned before. And the patient's son was not too happy about the way the nurse spoke to his father when the nurse was trying to clarify things. And we're going to the assessment part now, where which has to do with Mr. Rossi. Mr. Rossi's continuous question about when he will be going home. He tries to complete the self-care by himself with minimum assistance so he can go home. He also misunderstood the nurse's praise for his self-care as a promise that he will be going home. And, the plan part of the soap note includes has to do with when the plan, that's the future plan, or what needs to be put in place is to correct this miscommunication or misunderstanding is when speaking to Mr. Rossi. It is vital, or it is very important to ensure clarity. Speaker needs to be really audible and avoid ambiguity and jargon so that he'll be able to understand what the message is and not misunderstand it, just like what happened in the morning. And this is to avoid any form of ineffective communication. It is basically advisable to use the ask tell ask model, which has been mentioned before in the slide. And like I said, is advisable to use the ask tell ask model in most of the times to ensure that Mr. Rossi understand the information that is passed across to him. This way, there will be no misunderstanding, because what had happened that morning is most likely the nurse was not audible, was not clear enough, and might have used a number of jargons for Mr. Rossi, which caused the misunderstanding and yeah, led to the conflict between the nurse and Mr. Rossi's son. Next, we shall be looking at the S bar tool. Now, in this slide, we shall be discussing the S bar tool, which is the patient's clinical handover. And yes, before I go into this, I would like to throw a little light on what the S bar tool is. Now, the S bar tool is a communication tool used for communicating patient care information between healthcare professionals. So Hence, we shall be looking at Mr. Rose's care information in four orders below. And these are the situation, the background, the assessment, and recommendation. Now, in the situation part of this, we shall be discussing about basic information about Mr. Rossi, which his name is Mr. Rossi and he's 90 years old, and he's male by gender. The clinical problem and symptoms for Mr. Rossi is the inability to self-care and mobilize unsupervised, and the grieving over the loss of his wife and him being upset about leaving his family home. Early signs of dementia are also been noticed in this case study, as he seems to misunderstand conversations, and also he wants to go back home. Now the background here, Mr. Rossi is basically 90 years old Italian immigrant who had recently lost his wife, and the wife, as we know, always helped him in his self-care and mobility, and he has been deemed unsafe after the loss of his wife to self-care and mobilize without supervision or assistance. Hence, moved to an aged care. He was moved to an aged care facility for supervised self-care and mobilization. He still grieves over the loss of his wife, and is upset about being away from his family home. Now, in assessing this whole situation, the patient may be showing some signs of hearing impairment, as he was like he misunderstood what was said to him, or probably he didn't hear it clearly. And patient is also developing a possible early dementia, as he mixes things up and gets confused. And patient appear to be faced with a risk of fall and health-related diseases if unsupervised. Like, if he is not able to self-care, he's prone to disease to diseases, and that's the reason for the supervised self-care. And if he's not supervised during his mobilization, he might fall off his wheelchair, or hurt himself uh, he hurt himself in the process. Now, patient does not seem to like the new home, as he keeps asking when he'll be going back home. He keeps asking that question because he doesn't seem to like the environment, or the new environment he is in. And it's understandable, because he might not know the location of basic things, like probably the light switch, and the emergent restroom, or the toilet, the bathroom. He might not know the locations of these basic places, as it's a new place to him. Also, patient appear to be emotional as he grieves over the death of his wife. Um, Patient may want to perform self-care and mobility all alone, just to prove a point that he is ready to go home. He'll do anything possible to show them that he is fit to go home, and because he doesn't want to stay in the aged care facility. The patient may also be faced with loss of vision and poor balance on his leg, which is the reason for the supervised the supervised mobilization. The recommendations here include that patients should always be communicated to therapeutically. However, it is ideal to maintain clarity, assertiveness, and it is also advisable to use the ask, tell, ask model in order to check understanding of communication. Now, we need to carry out safety assessment both on the patient, that is Mr. Rossi, and on the environment, to ensure Mr. Rossi's continuous safety. And this should be done like maybe twice a week, or four times every fortnight. Patient also needs an optometry appointment, a physiotherapy appointment to check muscles, and a podiatry appointment to check the lower extremities at least once or twice every month. This is all to ensure Mr. Rossi's safety in his new environment. Next, we shall be looking at the professional communication contribution to patient safety and quality nursing practices. Now, proper professional communication can lead to the following: reduced error in clinical records, just like keeping proper medication history, patient medical history, medication expiry dates, and so on. These are essential to every patient's safety. Next is the reduction in clinical errors, which includes fewer medication errors like medication overdose and medication misuse. It improves healing process because when a patient identifies that the nurses are confident and professional, this basically contributes to the healing process as he or she, that is the patient, is comfortable and calm. Decrease readmission rate. A good healing process, such which includes good care, support, therapeutic relationship, can make healing last for a very long time. Lower infection rate. A good 5 minute hand hygiene communication, like if a good 5 minutes a good 5 moments of hand hygiene communication to the staff members by the facility, such as the posters placed on walls, is very important and very useful and can reduce infection rates for both patients and staff themselves. Now, patients tend to, spend less time in the lesser admission time. Patients tend to spend lesser admission time in the hospital because when nurses communicate professionally, they know what to do at every point in time with the patient. Hence, no back and forth. There's no back and forth with the patient or clinical errors with the patient's record, or even with the medication or an error in medication with the patient. This means that patients spend less time in the hospital. We also have the reduced anxiety in patients. Good and professional communication among nursing staff members and with patients actually builds the patient's confidence. Hence, it improves patient safety. We have the improved quality of life as well. When professional care is given, patient's quality of life increases significantly and he or she becomes self-confident. It also improves teamwork and cooperation among the nursing staff because when professional communica- when there's a professional communication between the nurses and even between the nurses and even between nurses and patients, it builds respect, it builds support and understanding also among the nursing staff members. This also ensures appropriate conflict management among nurses, and valuing, and also it leads to the value it leads to valuing others contribution and sharing accountability as well as responsibilities, and these have a very direct effect on the patient's safety and quality of nursing, as it gets the nurses to work as a team and understand each other as well as the patient. And we also have the improved problem solving and decision making among the nursing staff because collaboration, shared risk assessment, shared decision making, and regular outcome reviews is a necessity for patient safety and quality nursing practice. Also, we have the improved situational awareness, which makes it possible for nurses to identify future problem and strategizing on ways to deal with it. Recognizing other capabilities, and cross-checking and contacting external sources if possible in order to solve our future problems which have been identified. Then we also have easy access to medical records because through professional communication, it is easy for nursing staff to actually access the medical records and find out what they are looking for about a particular patient. Therefore, I can say that communication is the basic key that plays a significant role in keeping the healthcare organization together, as well as promoting proper patient-centered care, family-centered care, and professional relationship. Hence, quick patient recovery. Thank you.
Thank you for the audience.